While there may be many clinical side effects to diseases like prostate cancer, the psychological and emotional effects felt by both the patient and his spouse are sometimes overlooked. ABC News Chief Medical Editor Dr. Tim Johnson is on call with a look at some of the ways couples can cope with the road ahead. Dr. Tim?
Thank you, Tanya. It's a pleasure for me to welcome an old friend, Rabbi Ed Weinsberg, a patient health advocate. He has his doctorate in gerontology, but he's here today because he's a prostate cancer survivor, and he's written a book titled Conquer Prostate Cancer: How Medicine, Faith, Love, and Sex Can Renew Your Life. Welcome to the program, Ed.
Thanks, Tim. Pleasure to be here.
So let's focus on what's unique about men in wrestling with this disease. We'll get to spouses, of course, but in general, and I realize you have to generalize, what kinds of problems do men tend to wrestle with after they're diagnosed and treated for this cancer?
I think the number one problem, Tim, is that men are worried about the long-term effects, not only of the cancer, but of the treatment that they're going to be given. All kinds of things can come up, most notably ED and incontinence. And those are real issues, along with the usual pain and stress that come with any operation or procedure.
So the next question obviously becomes, how should men be helped? How can they be helped to deal with the issues of impotence and incontinence and all the other emotional reactions?
I think there's some very specific things one has to do. First of all, come up with the facts. As somebody once said, just the facts, man, not ma'am. In this case, let people know that while it's true that close to 2/3 of men who say have robotic surgery like I did, or other surgery, even other treatments, may get ED, there's so many medical palliatives and emotional things that one can think about to get through that phase of one's life. But it is a long-term kind of thing. As far as incontinence, on average, at most, 5% of men will have long-term incontinence, and that's itself, that fact alone, is reassuring.
And then the spouse. How is it that men and women can communicate around this issue? If they haven't been good communicators before, it's going to be even tougher.
Indeed, communication is the key, as in any marriage, whether or not there's a surgery, especially of this kind. I mean, there's no question that this is very delicate surgery, even though it can be short-term. I was in and out of the hospital in a day and a half because of robotics, and even other kinds of surgery are 2 or 3 days. There's the initial emotion of finding out you have cancer that can disrupt the relationship to the extent that the man may be shocked, the wife even more so. And they've discovered now that women's stress about these things lasts longer than men, long after the procedure is done. To handle that, men have to reassure the women that, according to the doctor, and every good doctor will say this, it's very, very rare to come out on the wrong end, which is to say to die from prostate cancer. It's considered much more of a kind of long-term illness and recovery rather than something which is going to be fatal. That assurance, which is statistically correct, is the first thing to calm things down. And these things have to be openly communicated between husband and wife. A lot of times there will be disruptions just plain due to an anxiety. And when you can take the anxiety out of the picture and look at things more realistically, that goes a long way. And as far as ED is concerned, clearly women are sometimes as affected as men because they're the other half of the equation.
And in your experience, wide experience now with this issue, do you say that all couples should seek some kind of outside help, rabbi, minister, priest, counselor, whatever? Would that be a pretty standard recommendation on your part?
I wouldn't say all couples. First of all, there's some wonderful support groups, either in person or, which is to say you go down the street or down, wherever the wellness center is, and you have a weekly discussion group with other men. I can think of many groups that do that throughout the country. Then, of course, there is the other part, which is there are online kind of things, forums, even phone support kind of things. And for many people, just talking out with friends informally and with one spouse informally will do the trick.
I know in your book you list a lot of resources for these various issues that do come up. You list faith, love, and sex, all apparently understandable. But since you're a rabbi, I have to, in closing, ask you to talk about the role of faith in this very secular kind of experience.
Well, for me, faith means at least three things. It can be faith in one's higher power. You don't even have to have a formal religion to have that kind of faith. It's a more kind of spirituality, the sense that someone up there likes you, will get you through. And part of that is also the notion that if you're predisposed to seeing the glass as being half full and half empty, that goes with it. It's kind of a lifelong optimism, but you can learn to do that kind of thing. The other faith you have to have is in your doctor. You know, the trust that he can get you through. I take a position that not every doctor is automatically qualified unless the patient from the get-go finds out the man, usually it's a man, has qualifications, experience with the particular procedure the doctor is going to take the patient through. And if one finds that's the case, going along for the ride is a good attitude because you know you're in good hands. And the third kind of faith I talk about is faith in oneself and one's own resilience and the capacity to bounce back.
Very, very important information, Ed. It's good to see you again and have you on the program. And again, the book is called Conquer Prostate Cancer, How Medicine, Faith, Love, and Sex Can Renew Your Life. Thanks for the time, Ed.
Thank you very much.
ABC News Now. Good to know.